Question orale, Leader of the Official Opposition.
Thank you, Mr. Speaker. Well, it's that time of year. It's cold and flu season, and we hear in this House and everywhere sniffles, coughs, sneezes, strained breathing, and worse. And unfortunately, more than 70,000 New Brunswickers don't have access to primary care, to a family doctor or a nurse practitioner to get care for this season's ailments. New Brunswickers are concerned about this, and last year the minister committed to what we and doctors and nurses and patients have been asking for, and that is community collaborative care. He committed to 4 locations. We heard more, as my colleague just mentioned, but specifically committed to Fredericton, Charlotte County, Dalhousie, and Sussex. Residents of those communities want to know what is happening because they have yet to see tangible progress on these critical healthcare centres. So I'm hoping we can start with Fredericton. Could the minister please update the people of the Capital Region the status of integrated community care here?
Minister of Health.
Thank you very much, Mr. Speaker. And I understand that people are concerned about primary care, and the member opposite talked about 74,000 still on the wait list. Well, again, Mr. Speaker, we've made significant progress in taking a number of those people off that list without primary care, putting them onto HealthLink so that they can have access to primary care through a number of clinics throughout the province of New Brunswick. So again, I know that those numbers are hard for the opposition to comprehend, because we have made significant inroads in reducing that list down to only 20,000 people here in the province of New Brunswick. That's progress, Mr. Speaker. And it may not be in the exact form that the members across the way want, but Mr. Speaker, we have clinics where HealthLink can take appointments, see people with those sniffles and coughs and even more severe situations, severe health care problems. So progress is being made. The opposition doesn't want to admit it.
Thank you, Mr. Speaker. The question was specifically about the commitment to build integrated community care in Fredericton. Could you update us on the progress of the Fredericton Clinic, Minister?
Minister of Health.
Well, thank you very much, Mr. Speaker. And when we get down to the specifics of some of the things that have been done in Fredericton, again, I point to the success of HealthLink and some of the clinics that have been opened up there to take primary care, to have access to primary care. And you can see that the number of the 3s and the 4s that are down in the clinic down here across from the Victoria Meat Market that is now accessible for not just walk-in but appointments through 811 and also through HealthLink. That's progress. That's taking people out of the emergency room, which was a very, very important aspect in treating the people where they need. And I know the members opposite are maybe a little testy today because they all got passed over for Senate. Maybe not as upset as Victor and Roger, but you know, and that's where, again, we continue to work and we continue to hire new doctors, recruit new nurses, increase the number of points of access in various locations right across the province.
Thank you, Mr. Speaker. Given that the minister hasn't provided any specifics about the location of the new integrated care clinic, that progress, their commitment to community developers, to committees with the community, I'm going to interpret that nothing has happened in Fredericton. So let's move on to Charlotte County. I was visiting the people of St. Stephen just a few weeks ago and had seen them last summer as well as last winter, and they are very keen to see progress on the promised clinic in St. Stephen. Could the minister update the people of St. Stephen what is happening with their committed integrated clinic?
Minister of Health.
Thank you very much. And again, if the member opposite would just take a drive around Fredericton, they can see that we're doing work on the Brookside Mall in order to have clinic there, and we expect that to be open within the next 6 months or so. You know. And you know, Mr. Speaker, this goes to a bigger, I guess, governance model here in the province of New Brunswick. And that is when we look at how decisions are made on a provincial basis right across the province. The members opposite, they seem to not want to have that collaboration, because we formed a collaboration clinic or collaboration committee between the two regional health authorities so that people could look at a provincial-wide scope. Now, we see the members opposite talking about their own specific ridings, and that's fine. I understand that. That's how they get elected, and maybe they're expecting an election or something. But the fact of the matter, the work continues to go on.
Thank you, Minister. Leader of the Official Opposition.
Merci beaucoup, Monsieur le Président. Je pense qu'on va être ici longtemps si ça prend 3 questions pour recevoir la réponse au niveau de Fredericton. Je ne sais pas pourquoi il ne pouvait pas donner cette information dans son première réponse. Puis aussi, on parle de Saint-Stephen à ce point. Alors, je pense que ça va être une circonscription libérale au futur, mais pas au moment. So could you please tell the residents of Charlotte County, it's not the Brookside Mall, so what is the location and what are the plans for the St. Stephen Integrated Clinic?
Minister of Health.
Once again, Mr. Speaker, I do appreciate the question from the opposition. And again, work continues in all aspects, all areas of the province. When I look at the number of integrated primary care models, there is one being worked on up in Edmundston, Lake Baker, whatever, one to service that area. And, Mr. Speaker, that's under Vitality. There are a number of in Dieppe that are coming forward, Mr. Speaker. And when we look at Shippagan, Lamech, and Inkerman, again, I've been to some of these I've been to some of these locations that are taking patients, that are having appointments, that are providing that primary care that wasn't being looked at when the Leader of the Opposition was advising Gallant. And the fact of the matter is that we have reduced the number of people without family doctor. That's a fact, Mr. Speaker. And the members opposite don't want to acknowledge that. That's fine. We know that care is...
Thank you. Leader of the Opposition.
Thank you, Mr. Speaker. I wonder if maybe I should be directing the questions to the member for St. Croix, so she would have the opportunity as Minister for Seniors to let her residents know what's happening, because every time we ask about Charlotte County, I get answers for other places. So this time I'm going to try. The next commitment from last year's speech from the throne was for an integrated care clinic in Sussex. Could you tell us what's happening with that clinic, Minister?
Minister of Health.
Well, thank you very much. And again, Mr. Speaker, there's a lot of discussion going on in regions right across the province of New Brunswick. And when we look at access to primary care, we know that things are happening in Sussex. I visited an NP's clinic, which was new, again, providing access to primary care. And it is in conjunction with the hospital, and there's more work to be done there as well. And Mr. Speaker, when we look at a number of the jurisdictions that we have right across the province of New Brunswick, we are actually increasing the number of doctors that are available for people to go and see. We are actually increasing the number of NPs that people are available to see. And we're actually increasing the number of RNs that are available to work in the various hospitals around the province. And we're not satisfied with that. We are going to continue to recruit, whether it's international, whether it's within the seats that are created here in the province of New Brunswick, to increase the number of RNs that are available.
Chef de l'Opposition.
Merci, Monsieur le Président. I very much appreciate the specific answer of a nurse practitioner clinic set up in Sussex in partnership with the hospital. Could the minister tell us how many people came off of the Patient Connect or Health Link combined waiting list to receive services from that clinic?
You know, Mr. Speaker, the member across the way knows that a list of number of people that go to a doctor is not something that the minister would have in front of him or call from knowledge. And those are rules that are basically some of the guidelines that are set out within the questions in the rules for the legislature. And I can quote the section or send it over to the member opposite. And I don't know if the member opposite again is just trying to dig down into some of the local areas because they want to use that as part of their election platform as they hope for an election. But the fact of the matter is, whether there's an election or not, we are going to continue to do the work to make sure that people have access to primary care here in the province of New Brunswick. That work will continue. And I think the members opposite should be very clear whether they're going to regress back to a governance form that was under the Gallant government, where it was a regression, so that there's no more collaboration. It's not provincial-wide.
Thank you, Minister. Chef de l'Opposition, official.
Merci, Monsieur le Président. I'll remind the minister that the 4 areas we're looking at were commitments that his government made to advancing the model of care that everyone wants. And so I've covered 3. We'll try the last one. We got some progress on Fredericton, no answer for Charlotte County, a bit of information on Sussex. La communauté de Dalhousie était la 4e communauté où ils avons promis une clinique collaborative. Alors, Monsieur le ministre, c'est quoi le progrès pour Dalhousie?
Minister of Health.
Well, again, Mr. Speaker, I appreciate the question opposite for the member, and we have that provincial-wide approach to a number of clinics, whether it's primary care, integrated practice, expansion of Horizon Clinic, individual practitioners, and that's why we're encouraging to get into place. We have a number of other doctors that we're talking to again have those clinics, have them open up, and we're more than happy to again continue to recruit doctors, nurses, LPNs, increase the number of seats. We've increased the number of seats for RNs here in the province of New Brunswick, and we've increased the international component of trying to get internationally trained and educated people here in the province of New Brunswick to provide the service to the people. Provide this service to the people that we serve day in and day out. Members across the way are just self-serving, but we're serving the people in the province of New Brunswick.